The tooth movement is separated into translational and rotational movements. Moving the teeth labial or buccal is called expansion or protrusion. It is retraction that moves the teeth to the lingual side. Moving the teeth closer to the midline is called mesialization. Moving the teeth away from the midline is called distalization. The vertical movement of teeth along the occlusal plane is called extrusion. The vertical movement of teeth in the opposite direction to the occlusal plane, alveolar direction, is called intrusion. Rotating the teeth clockwise is plus rotation. Counterclockwise is negative rotation. Tilting the teeth to the labial is plus torque. To the lingual is minus torque. The mesial incline of the teeth is plus tip, and the centrifugal inclination is minus tip. Both expansion and plus torque cause the protrusion of the gingiva. In the case of expansion, the shape of the gingiva is greatly changed because the tooth bodily moves. In the case of torque, the shape of the gingiva is little changed because it is rotational movement. This allows for more complete setup. The left side moved the 4 anterior teeth through expansion, and the right side applied plus torque only to the central incisors. The case on the right formed a more ideal arch line. Mesiodistal movement moves along the occlusal plane and does not change its vertical position, but tip movement causes the vertical position to change as the tooth is tilted. When adjusting the space by mesial distal movement, there is no change in the long axis of the tooth, and no functional or aesthetic improvement effect. And there is an improvement effect in the case of tip movement. Uncontrolled tipping is a method of moving the crown by shortening the central axis of rotation. There is also a way to move the body through horizontal bodily movement while incline without moving the center of rotation. This is the most realistic movement method that places the rotation center on the root of the tooth and rotates it largely based on the root of the tooth. There is also a way to move the body through horizontal bodily movement while incline without moving the center of rotation. Finally, bodily movement is a method of moving parallel to the occlusal plane without rotation. Since it is a difficult movement with a clear aligner, you can successfully set up by mixing the movements described above.